Hi, I'm Garrett Durkin from FBC, and I want to thank you all for taking the time to watch this presentation on the First Arizona Title Agency Employee Benefit Plan. And we're going to go ahead and review any of the changes that are coming on January 1st to the Employee Benefit Plan for First Arizona Title Agency. But before we do that, I just want to let everyone know that our staff here at FBC are here to help you throughout the year, not just open enrollment. So if you ever have any questions on how you're enrolled, claims issues, billing issues, whether or not your doctor's in or out of the network, anything regarding your employee benefit plan, please feel free to give us a call Monday through Friday, 8:30 to 5 p.m. We'll get back to you as soon as we can. We'll try to help you there right on the spot when we answer. Whatever we can do to address your needs, we want to make sure that you have everything you need when it comes to your employee benefit plan. So with that, we'll dive into what's going on here for January 1st and the upcoming changes, and we'll get all your questions answered. So right now we are starting our open enrollment time frame for the January 1st plan year, and we're going to ask that everybody complete all your elections by December 9th. We'll be enrolling through the Employee Navigator system, and we need every one of you, regardless of if you're making a change or not, to log in and go ahead and make your elections on how you want to enroll by December 9th. After December 9th, the portal will close, and if you didn't log in and make your elections, then you will not have the enrollment for January 1st. So we want to make sure that you get all the information you need and you go in and make those elections by December 9th there. Now, your plan year for the medical goes from January 1st, 2017 through December 31st for 2017. So for any changes that you make, they will take effect starting January 1st, and they'll last for the remainder of that year. For the dental and vision, you'll notice that the plan year actually goes from December 1st through December 31st of next year. Now, that's because your renewals were off from the medical and the dental and vision, and we're trying to line those up for you. So any changes that you make, you'll still be able to make those changes at this time, but they'll go into effect retroactively back to December 1st. So just keep that in mind. Most of you will probably keep the same things because nothing's changing on the vision or dental, and it won't impact you very much. But if you have a question, or if it does, please give my office a call. We'll help you manage through this change. But this is the time of year that for any of the products, you can change how you're enrolled, add a dependent, take a dependent off, come on the plan for the first time, do whatever you want without having to have a qualifying event or a life status change. And a life status change is one of these 7 things. It's maybe you had a baby, you adopted, you became a legal guardian, maybe you got married or divorced, God forbid, but maybe you had the death of a spouse or dependent. Maybe you went from full-time to part-time or vice versa. Maybe you had a change in your spouse's employment status, so maybe they were covered under their employer's plan and they lost their job, or they left that plan for whatever reason, they lost their coverage, they could come onto your plan mid-year. Okay, maybe you had an unpaid leave of absence of more than 31 days for you or your spouse, or you had a change in your dependent's eligibility. So maybe your kids were on your spouse's plan or an individual policy and they lose that coverage, they'd be able to join your plan mid-year. These are all things that would allow you to change how you're enrolled or add a dependent mid-year should you have one of these 7 things. Outside of these 7 things, though, whatever you choose for January 1st, that will be your elections and what you'll be locked into for the remainder of the year. Okay? Now, it's important to note that you only have 31 days to notify Human Resources that you'd like to make a change. So if something happens to you mid-year and you want to make a change, you have one of these 7 things happen, you need to notify Human Resources within 31 days, because on the 32nd day, Human Resources' hands are tied, and that's not our rule or Cigna's rule or MetLife's rule. That's federal law. So we need to make sure we operate inside of what we have to with the Affordable Care Act. So please keep that in mind. I know that often when these big life events are happening, insurance is the last thing on your mind, but we do want to make sure you're properly covered, and if you do need to make a change, we get that done for you. Okay, with that, we want to just kind of go over a brief summary of what we'll be reviewing. We are going to be continuing on with Cigna for our medical insurance, which is great news. We're going to continue to offer both the Local Plus and the Open Access Network. Of course, the Local Plus network will give you the deepest discounts and the least expensive plan out of your paycheck, but the Open Access will be available to you if you want to purchase that. Now, this year we are implementing a new deductible reimbursement program. This means we are going to buy a higher deductible plan, but the company is going to reimburse you just as if you had a lower deductible plan. We'll go over how that works here in a second. And then we're going to continue on with HealthiestYou, our telemedicine feature, which we're really excited about, and we know that a lot of you guys have used. And for those of you who haven't, we want to make sure you know you have this and are able to utilize this should you need to. For all the other coverages, the dental plan, the vision plan, the life and accidental death and dismemberment, along with the voluntary life insurance, that is all going to continue on with MetLife, so there's going to be no changes to how those plans work or no changes to the network, but we do want to go over them so you know how they work and get any questions you might have answered. Okay, let's dive into the medical. Now, what we are doing is purchasing a $5,000 80% plan from Cigna. Now, this plan is going to work exactly the same whether you're on the Local Plus or the Open Access Network. There's going to be no difference in how the plan functions with its copays. The only difference will be the network and then also the reimbursement structure for the deductible reimbursement program, which I'll go over here in a moment. But for now, I want to focus on how the actual plan works with the day-to-day copay structures. So for either plan you pick, here's how this is going to work. If you go into the primary care physician, you pay a simple $30 copay. A copay, remember, is just you pay the 30 bucks, you go home, Cigna pays the rest, right? If you go to a specialist, it's a $60 copay. And then your preventative care is covered at 100% no cost to you. So that's your annual physical, your annual OBGYN exam. It is your colonoscopies, mammograms, wellness visits for your kids, all the things that the doctor says, look, at these times in your life, once a year, once every 10 years after 50, whatever it might be, you need to come in and get a physical, an OBGYN exam, a wellness exam for your kids, whatever it might be, just because that's the healthy thing to do. Those are considered preventative services, and you won't pay a copay, deductible, nothing. It is 100% covered by Cigna. For all your other diagnostic services where you have an ailment or you have something you're trying to get solved, that's where you'll pay your copays and deductibles. Okay, so in addition, you have an urgent care copay of $65, emergency room copay of $250. So you'll notice that if it's not a true emergency and you still need to see somebody, but you can get by going to an urgent care, you'll want to because you're going to get seen a lot faster. You're going to get about the same care, and you're going to pay a whole lot less than going to the emergency room. So if you need to go to the emergency room, that benefit is still there, but if you don't need to, you're going to be much better off going to the urgent care. Okay, now like I mentioned, we are purchasing a $5,000 deductible plan per individual and then $10,000 per family. Now remember, you as an employee will not be responsible for the entire deductible, but we do want to make sure that you understand how the underlying health plan works. So the employee is responsible for the first $5,000 of the deductible. After that is hit, then Cigna will come in and pay 80% of everything after that, and employees will pay 20%. Once the employee's 20% adds up to another $1,550 so that you have exceeded or met the $6,550 out-of-pocket maximum, Cigna will cover everything at 100%. So the most you could possibly be billed on this plan is $6,550. And of that, you will get some of your deductible reimbursed by First Arizona Title Agency, which I'll go over in a second. But the only things that will ever trigger your deductible are if you go into the hospital, you have outpatient surgery, or you have major diagnostic testing like MRIs, CAT scans, PET scans, x-rays, things like that. Everything else has a copay. So for those three things, you have the deductible, then the co-insurance until you hit your out-of-pocket maximum, and First Arizona Title is going to help you out with some of that. So before I dive into the deductible reimbursement, let me review your prescription drug program. You have a $15 copay for generics, a $40 copay for preferred brand name Tier 1, and a $70 copay for preferred Tier 2 drugs, okay? And so those are the copays you pay if you're taking those drugs. Depending on what tier they fall in, you walk in, you pay that copay, and you're on your way. Now, I always point out that generic drugs are available at most big box pharmacies for $4. So if you haven't met your out-of-pocket maximum and you want to save a little money, likely you can not use your Cigna insurance, and for generic drugs only, you can pay around $4 for your drugs. What happened is Walmart figured out 17 years ago that if they gave their cheap generic drugs away for $4, people were going to come into Walmart and buy shoes and clothes and food and all the other things we buy at Walmart, and it worked. So now every big box pharmacy does this. So if you walk in and hand them your Cigna card, you'll likely pay $15. Otherwise, If you ask what it is without your insurance, it's more like $4 for your generic drugs. Not so much for brand name drugs, but for generic drugs most definitely. So this is how the underlying health plan with Cigna works. Let me review with you this deductible reimbursement program, as this is the newest thing that we're implementing. So what we're actually doing is we're purchasing a $5,000 deductible. Now, why are we doing this? It lowers the premiums significantly. And we're able to not just lower the premiums for the company, but also for employees, specifically those of you who have dependents. You are getting the benefit of either having a $2,000 deductible or a $3,000 deductible, depending on which plan you choose, but you're only paying the premiums on a $5,000 deductible. So it's a fantastic way to lower the cost for everybody all around, while still giving you guys a low deductible option. Okay. Now this first example shows you what would happen if you enroll in the Local Plus plan with the deductible reimbursement after $2,000. The way this is going to work is that if you're enrolled in this plan, the first $2,000 of the deductible is the employee's portion of the deductible. You're responsible for that first $2,000 just like you would be today. Of the last $3,000, First Arizona Title Agency is going to reimburse employees who exceed the $2,000 mark at 80%. So if you max your deductible out, you'll pay 20% of the last $3,000, so another $600. Okay, so this is a very rich plan. You still have a $2,000 deductible, and then after that, you're only liable for another $600 until you break into the 80-20 split with Cigna. Okay, now if you're on the open access network, what's going to happen is very similarly, First Arizona Title is going to reimburse you at 80%. However, it's going to happen after $3,000. So you'll have a higher deductible if you choose to be on that bigger network. So the only difference between the two plan options on the medical is the network of doctors and hospitals you can see, and then the deductible reimbursement structure. If you're on the open access network, you have the big network, but you have a higher deductible. If you're on the Local Plus network, you get to go to all of the Banner doctors and hospitals and all of the Honor Health doctors and hospitals, which is John C. Lincoln and Scottsdale Healthcare since the merger, and you have a $2,000 deductible. And in addition, you'll pay lower out of your paycheck. So if you can find a way to stay in that Local Plus network, you're going to do the best. You're going to pay the least out of your paycheck. You're going to pay the least when you use your plan, and you're really going to get some of the best care in the Valley, as both Banner and Honor Health are nationally acknowledged hospital providers, and it's about 4,000 of the best doctors and hospitals here in town. So this is how the deductible reimbursement program will be structured. This is the difference between the plans. Now you might be asking yourself, okay, so how do I get this money if I exceed these deductible marks? Well, all you have to do is fill out this one-page claim form, which you can find this in Human Resources. Call my office, we'll get it to you. It's also going to be uploaded in your Employee Navigator web portal. But you fill out this one-page claim form, you sign it, and send us your most recent explanation of benefits. This is the thing that comes in the mail, says this is not a bill, right? We've all seen these, breaks down all your charges. You'll send that information to my office, and then we'll turn around and let First Arizona Title Agency know how much they should reimburse you for. Now, First Arizona Title Agency will not get any of your medical information. They don't want to know what's going on in your medical history. We just want to be able to tell them how much they need to write you a check for. Now, when you get this money, it's very important that you don't just go on a shopping spree with it. You make sure that you pay the doctors and hospitals, because the doctors and hospitals are going to bill you for that full $5,000 deductible. So the money is there to help pay for your qualified medical expenses. But that's how we're going to structure it, and it's a much more efficient and effective way to run our medical plan. Now, in addition to this, we're going to continue on with the Healthiest You product. This is a supplement to the medical plan. So if you're enrolled in the Cigna medical plan, you will also have Healthiest You. And what this is at the core of the product is a telemedicine feature. And what that means is 7 days a week, 24 hours a day, 365 days a year, you'll have access to a live physician via the phone, web chat, or Skype, and you'll be able to pick up the phone and within 15 minutes talk to a live physician of the correct practicing nature, meaning that if it's a rash that you're dealing with, you'll talk to a dermatologist. If it's the flu, you'll talk to a primary care, so on and so forth. But they have over 23 licensed doctors, not nurse practitioners, licensed doctors that you can talk to diagnose 50 to 70% of all the most common services that we go to the doctor for, and write you a script there over the phone to any pharmacy that you need. Okay? When you use this service, you pay absolutely nothing. It is free to you. So if you're enrolled in the Cigna plan, you'll also be enrolled in Healthiest You. It'll cover you and all your family members, regardless of if they're enrolled on the Cigna plan with you. And you'll have access to this where you'll be able to pick the phone up, talk to a doctor, get your script, and move on with your day. And so where this really helps out a lot is when you have a child who's got an ear infection, pink eye, you got a cold, you got the flu, and you don't necessarily need a doctor to diagnose it. You just need to get the medicine that will get you better. And you don't have time to leave work or get the kids out of school and go wait in the doctor's waiting room, wait around, get your script, go wait for the script to be filled, so on and so forth, like we're used to. And you'd rather just pick the phone up, and within 15 minutes you'll have spoken to a doctor, been diagnosed, and you can just drive to the pharmacy, get your script, and move on with your day. It's a much more efficient and effective day of utilizing your health care. And also, in addition, they have other services where you can find which pharmacies will sell your drugs at the cheapest cost, where you can get the lowest cost x-rays and MRIs and CAT scans. And so there's a lot of cool features on the app that you want to check out, but the core of the product is the telemedicine piece. So please be on the lookout for information in the mail regarding this, and also information in your email regarding this. But if something happens to you throughout the year and you think it's something you could get diagnosed over the phone, please go ahead and give it a try. You're going to love this product. All right, the last piece of the medical plan here is that we are continuing on with the flexible spending account. What this is a way to set aside pre-tax dollars to help pay for medical and dependent care expenses. And the way this works is that you can designate up to $2,600 per year for medical expenses and $5,000 for dependent care expenses towards the cost of, towards these expenses that where you can take out of your paycheck on a pre-tax basis. So not only do you get to skip your federal and state income tax, but also your Medicare and Social Security taxes. This money goes into the flexible spending account. Throughout the year, you can use it on any qualified medical expense or dependent care expenses. And then, of course, if you're not married and you're filing, or you're married and filing separately, you'd only be able to put in $2,500 towards dependent care expenses. But it's a great way to pay for these expenses that you might know you're going to use anyways on a pre-tax basis. Now, the important thing with this is if you don't use this money, only $500 of it will roll over next year. So you got to do a good job of trying to predict what's going to happen throughout the year, because if you got more than $500 in there and you don't use it by the end of next year, it will go away and you'll lose that money. So we don't want that to happen to you, and we want to make sure you're all taken care of there. If you're enrolled and you have money in there now, but you're not going to enroll and you're going to unenroll next year, you do need to spend that money before the end of this year. So we want to make sure that we get that taken care of, and you know that. But that is how our flexible spending account is going to work. And with that, guys, you'll see here are the payroll deductions. This is online on the Employee Navigator tool, but you can see them right here. And this is what I was mentioning. You have the Local Plus network being the most affordable plan, and then the Open Access network is more expensive. In addition to that, you have the higher deductible on the Open Access network. So again, if you can stay on the Local Plus network of Banner and Honor Health Physicians, you're going to be better off. But these are your payroll deductions per paycheck depending on how you're enrolled. All right, the rest of these products we're continuing on. Nothing's changing on how they work. Nothing's changing about the network. We do want to review them with you. The dental plan here, you have a $75 deductible per individual, and then $225 per family. That's just 3 deductibles in a given family. Your preventative care is covered at 100% no cost to you. So that's your 2 cleanings and your 1 x-ray. Okay, and then your basic services like fillings, simple extractions will be covered at 80% after your $75 copay. And major services like crowns, dentures, bridges will be covered at 50% after your your $75 copay. Your annual maximum per person is $5,000. This is a fantastic benefit. The average annual maximum in the state of Arizona is $1,000, and First Arizona Title Agency is taking care of you guys by offering you guys a $5,000 maximum plan. This is just absolutely the richest plan you can buy. And then you do have orthodontia coverage at 50% for your children, up to $1,000. So it only works for your children, but they will pay 50% of the cost of orthodontia services up to $1,000. Now, The other two important things on this is there are no waiting periods for basic or major services. So if you get on this plan effective on December 1st, you can start using basic or major services right away, which is great news. In addition, you could get balance billed if you go out of network. However, as long as your dentist is charging what is considered usual and customary charges as 90% of the other dentists, then you'll go ahead and get those services covered as in-network anyway. So you can see that the out-of-network services look as if the benefits are exactly the same. And if your dentist is charging usual and customary charges, then yes, they are. However, there is a chance that you could get balance billed, meaning that they'll bill you on top of what MetLife pays them. Okay. The payroll deductions are as expressed here, depending on how you're enrolled. This is per paycheck, and this is also in your Employee Navigator portal. The vision plan with MetLife, again, it's not changing, but we do want to review it. You have an eye exam at a $10 copay. Your materials and your standard lens, single vision lenses will be covered at $25 copay, so you just pay that and you're on your way. Frames will be a $130 allowance, and contacts are also a $130 allowance. That's exactly what it sounds like. If you get frames, they'll pay up to $130 of the cost, and you'd pay the difference. So if your frames are $130 or less, you wouldn't pay anything. If they're $150, you'd pay 20 bucks. If they're $200, you'd pay $70, so on and so forth. So same thing with contacts. And then you can get an exam once every year, and lenses, including your contact lenses, once every year. And frames you can only get once every 2 years on this plan. Now, if you do decide to get frames in a given year, you cannot get contact lenses in that same year. So it's one or the other. But remember, you can get your contacts every year. You can only get frames every 2 years. And then, of course, if you go out of network, there's applicable allowances that they'll apply towards the cost of your plan as well. These are your payroll deductions per paycheck, depending on how you're enrolled. All right, guys, and then we also are going to be continuing our life insurance, our basic life and accidental death and dismemberment through MetLife. First Arizona Title Agency pays the full cost of this benefit. I do want to stress the fact that this is an extremely rich benefit. It's the highest term life policy they can buy for employees. You all have this just by virtue of being eligible for the benefit plan. The average life insurance purchased from an employer in the state of Arizona is $15,000, so this is above and beyond the average. And what this means is that each one of you will be able to get your beneficiaries $50,000 of life insurance should the worst happen to you. And if you were to pass away in an accident or become disabled, it would go from $50,000 to $100,000. So please let us know who your beneficiary is. We want to make sure we get this money to the right folks should the worst happen to you. Otherwise, it'll end up in probate, and we do not want that to happen. That is no fun for your family, and we want to make sure you're all taken care of on those things. In addition, you'll be able to purchase additional life insurance should you wish to, and you can purchase that in increments of $25,000 up to either 5 times your annual earnings or $500,000 of life insurance. If this is your first opportunity to enroll in the plan, then you actually have a guaranteed issue amount of $100,000, meaning that if you want to buy $100,000 of life insurance, you will not have to answer a medical question. It's guaranteed to you, and you will get approved for it. If you have had this opportunity in the past and you've declined, then you will have to answer medical questions, but you can purchase up to the maximum of 5 times your salary or $500,000. You can also purchase coverage on your spouse in increments of $5,000 up to $100,000, or 50% of your employee amount. And what that means is if you only purchase $100,000 as an employee, you'll only be able to buy your spouse $50,000. You also have to buy life insurance on yourself in order to get life insurance on your spouse. You can't just buy it on your spouse. Your spouse will have $25,000 of guaranteed issue if this is the first time you are having the opportunity to enroll, so keep that in mind. And then your children, you can elect $1,000, $2,000, $4,000, $5,000, or $10,000 in life insurance. You'll pay that amount on one child, and it'll cover all your children. I know it can be a little morbid to try to think about buying life insurance on your kids, but should the worst happen, they want to make sure that you have some money to get through that grieving process and lay your children to rest should you need to. So that is available to you if you're interested, and that's through MetLife as well. All right, the last two benefits here are the voluntary short-term disability and the long-term disability. These are the most underrated benefits in America, and they're both with MetLife. This is something First Arizona Title Agency pays for at 100%, covers the full cost for you guys. I can't stress how important these benefits are, because if you didn't have dental or vision benefits, it'd be really hard to pay for your glasses and dental care, but you probably wouldn't go bankrupt. If you couldn't work because you were disabled and you couldn't get a paycheck, that's a much bigger problem. And so this is intended to take care of First Arizona Title Agency's employees, so that should the worst happen, you have some money coming in, so you don't end up going bankrupt and having to sell all your assets to just get by. So the way this works is that the short-term disability, after 15 consecutive days of being declared disabled by a doctor due to a non-work-related sickness or accident, the coverage will cover up to 60% of an employer's salary, up to $1,000 per week. So if you go out on short-term disability after 15 days, you'll start getting 60% of your income, up to $1,000 per week maximum, to help you pay the bills while you're out. And the benefit will last for 11 weeks. Now, keep in mind, short-term disability will work for maternity, and maternity typically a 6-week, for a standard pregnancy, it's a 6-week disability, and so you'll have to wait 15 days before that kicks in, and in the remaining 4 weeks, you'll go ahead and be able to get paid the 60% of your income, up to $1,000 per week. So keep that in mind if you are planning on having a baby or going out on maternity leave. It is available for you. Now you'll notice it goes for 11 weeks, and when you add in the 15 days, that's 13 weeks, or otherwise 90 days, and that's when your long-term disability kicks in. And so the way long-term disability works is, after you've exhausted your short-term disability and you've hit the 90-day mark, long-term disability will come in and cover you at 60% of your income, up to $6,000 per month. So this is really meant to take care of you in the long term here. It'll pay out till normal Social Security retirement age, which means that, for a lot of us, it's age 65, but for younger generations, it's 67, and it'll probably continue to tick up. But whenever you're eligible to file for full retirement in Social Security, that's when the disability would go to. So it would get you through your working years into retirement and take care of you should you become disabled and not able to work. It'll cover a total disability, partial disability, or recurrent disability. Guys, this is an extremely rich plan. We want to make sure that you guys know what's available to you. It's absolutely our First Arizona Title Agency's intention to make sure that all of its employees are taken care of financially, and you guys can rest assured that should the worst happen, you're working at a place where they care, and they want to make sure that you have all the financial tools that you need, so you can focus both on the job, but also on your personal and family life, because that's just as important as well. Okay, guys, I appreciate you taking the time to watch this video. I know insurance sometimes is not the best topic, and people, it's kind of, people want to tune it out and don't want to think about it too awful much, but it is very important that you get this information and you make your elections. We're working really hard to provide you guys with competitive benefits. I do this for much larger employers nationally across the country, and your guys' benefits are hands down some of the richer benefits that we offer to employees. They're fantastic, and it's First Arizona Title Agency's way of saying thank you for your loyalty and hard work. They want you to be here at the agency and feel comfortable that you're taken care of. And so we've strived to do that. We think we've done a good job, and I can attest to the other clients that I work with at First Arizona Title Agency is really doing a good job of trying to look out for its employees. So if you guys have any questions, please don't hesitate to call my office. The phone number is 602-277-8477. Again, we're open Monday through Friday, 8:30 to 5 p.m. If you call us after hours, leave us a message. We'll get back to you the next business day. You can shoot us emails. However we can help you, you let us know. We're there to help you. And please remember, everything is due by December 9th. You'll be getting an email on open enrollment here shortly, if you haven't already got it, regarding the Employee Navigator system. Everyone will need to log in and make your benefit elections by December 9th.